Welcome back to the Medcurity podcast. Today we are addressing a question that comes up constantly. Why is healthcare such a big target for cybercriminals? You may have heard that healthcare is one of the most attacked industries, but why? Is it because of outdated technology? Is it because of sensitive data? Is it because healthcare organizations are considered easy targets? The answer is yes, but with some added details. By the end of this episode, you will understand why cybercriminals focus on healthcare, what makes healthcare uniquely vulnerable, and what this means for leaders and for teams on the ground. So let's dive in. Let's start with the most obvious reason. Healthcare data is incredibly valuable. A single medical record often contains a full name, a date of birth, a social security number, insurance information, medical history, billing details, and contact information. So unlike a credit card number, which can be canceled, medical data is permanent. That permanence makes healthcare data especially valuable on the black market. It can be used for identity theft, insurance fraud, prescription fraud, and long-term exploitation. From a cyber criminal's perspective, healthcare data offers high value with lasting usefulness. The second reason healthcare gets targeted so heavily is urgency. Healthcare organizations can't simply go offline. Appointments need to happen. Medications need to be dispensed. Patients need care, and cyber criminals know this. The more urgent the environment, the more leverage an attacker has. That's why ransomware is so prevalent in healthcare. If systems are locked, operations grind to a halt and pressure skyrockets. That pressure increases the likelihood of quick decisions and, in some cases, of a ransom payment. Here's our third reason. Healthcare environments are complex. They often include EHR systems, billing platforms, imaging software, scheduling tools, patient portals, medical devices, mobile devices, remote access systems, third-party vendors, and so on. And each system, user, and connection adds to the attack surface, which is the number of ways that an attacker could potentially gain access. The larger and more complex the environment, the harder it is to secure it consistently. And that doesn't mean healthcare is careless. It means healthcare is complicated. Another major factor here is vendor dependence. Healthcare organizations rely on vendors for EHRs, IT support, cloud hosting, billing and coding, transcription services, telehealth platforms. Each vendor introduces potential risk, especially if security expectations aren't clearly defined or monitored. Cybercriminals often will target vendors because one breach can impact many clients. Vendor access may bypass some of your internal controls, and trust relationships can be exploited. And that is why vendor management is such a critical and often overlooked part of healthcare security. Next, let's talk about people. Healthcare staff work in a fast-paced, high-stress environment. They juggle patients, paperwork, technology, and time constraints, often all at the same time. This creates conditions where phishing emails could slip through, links might get clicked quickly, credentials may be reused, and shortcuts might feel necessary. Cybercriminals will do their best to exploit that urgency, trust, and routine. So training, awareness, and supportive workflows make a huge difference here. Historically, many healthcare organizations prioritized patient care over IT security, and that's understandable, but that legacy remains, and some organizations are still running outdated systems, lacking dedicated security staff, struggling with very limited security budgets, or catching up to modern threat landscapes. Cybercriminals are looking for that imbalance, and healthcare has historically been stretched thin. But the good news is, awareness is growing, and security maturity is going to improve across the industry. So what does all of this mean for leaders? It means healthcare isn't targeted because it's careless. Healthcare is targeted because it's valuable, urgent, and complex. And most importantly, security doesn't require perfection. It requires intention and consistency. Regular risk analyses, layered safeguards, staff awareness, vendor oversight, and good documentation will dramatically reduce risk. You don't need to solve everything at once. You just need to keep moving forward with the next step. And now that you understand why attackers focus on this industry, hopefully that gives you the clarity that you need to make smart, calm, and more effective security decisions. So if today's episode was helpful content for you, then go ahead and share it. And if you're looking for tools that help you identify risks, track safeguards, and strengthen your security over time, Medcurity is built to support healthcare organizations of all sizes. Thanks for listening, and we will see you next time on the Medcurity podcast.